called to a local high school for possible hemorrhage. Upon arrival, you are escorted by the principal to a girls' restroom, where you find a teacher sitting on the floor holding a crying 14-year-old girl, while a second teacher holds a bloody towel over the wound to the girl's left wrist. A broken piece of glass is lying on the floor covered in blood. You observe approximately 300 milliliters of bright red blood on the floor. The teacher holding pressure informs you that the girl was found about 10 minutes prior to your arrival by a classmate. There is an approximate 3-inch laceration over the teenager's left wrist.
Okay, so first thing I would do would be PPE. Is the scene safe?
Yes.
And mechanism of injury would be the laceration. There's one patient, and I would not consider additional ALS, and I would not give her a C-spine due to the lack of head or back injury that I know of. Then what is she alert?
Level consciousness, responsive, and answering questions appropriately.
General impression of the patient.
14-year-old girl sitting on the bathroom floor, visibly upset with a bleeding laceration to the left wrist.
Chief complaint.
3-inch laceration to the left wrist.
Then I would do airway, so I check to see that she has a open airway.
Yes.
I would check her breathing, so adequate chest rise and fall, lung sounds, and SpO2 reading using a pulse oximeter.
SpO2 is 98%. Lung sounds clear bilaterally. Normal rate and volume breathing, adequately symmetrical rise and fall of the chest.
Okay, and then I check circulation, so I'd look, was she a strong?
Radial
regular?
pulse, rapid and strong.
Sure. Okay. And then I would transport her due to her bleeding, and I would have my partner take over for the teacher holding pressure on the wound to make sure that he's holding pressure on her laceration. And then I'd get a sample history. So situation is she cut herself. Does she have any allergies?
None.
Medications?
Prozac for depression.
Permanent medical history.
Depression.
Last time she ate.
Lunch approximately 1 hour ago.
And then the events leading up to the incident.
Break up with her boyfriend at lunch.
Okay, and then I'd get her baseline vitals, so blood pressure.
114/72.
What is her pulse rate?
104 beats per minute.
What is her respiratory rate?
16 breaths per minute, irregular and crying.
Pupils?
Pearl.
Okay. And skin color. What's her skin?
Warm, pink, and dry.
Warm, pink, and dry. Okay. Then I start my secondary assessment. So I would palpate her head and her ears, look at her eyes, nose, mouth.
Head, no injuries noted.
And look at her neck. So I look at trachea position, her jugular veins, and her cervical spine.
No JVD, no tracheal shift.
Okay. Then I would palpate her chest.
No injuries noted.
Palpate her abdomen, pelvis.
Stable pelvis, abdomen soft and non-tender in all 4 quadrants. No genital injury.
Okay. Then I'd palpate her lower extremities and check her PMS.
Extremity assessment: pulse, motor function, and sensory function (PMS) present in all 4 extremities. No other injuries other than described previously.
Palpate her upper extremities. Same thing, yeah. I would reassess her every 5 minutes.